Greetings, my fellow Coloradans. Thank you for joining us today. Happy February, a new month. Light on the horizon as more and more Coloradans get immunity. We are close to 500,000 Coloradans who've received their first dose. We're at 473,977 in the next day or two. We'll pass 500,000 Coloradans who've gotten the first dose of the vaccine, which offers some level of protection. About 140,000 Coloradans have received both doses. Today, 935 new cases. We continue to have stable infections at a relatively high rate. They're 1,000 a day or so, if not more. But at least it's not growing, which is good news. 529 hospitalizations continue to decrease. These are hospitalizations with people due to coronavirus. These are coronavirus hospitalizations. That went down 27 in the last day. I want to begin, of course, by expressing my condolences to all those who've lost family members, loved ones, friends to this deadly virus. I know this is a very difficult year for all of us. For those who are still recovering, I wish you a speedy recovery. And I'm proud to say that our COVID trends are generally continuing to move in the right direction, but there are exceptions in our state. Some of our mountain and ski resort communities have increasing rates of the virus. Pitkin, which was one of the highest 2 weeks ago, has a decreasing rate, so we're glad to see that, but we're worried about some of the others that are increasing. And it's important, no matter where you live in our state right now, at this point in time, to wear a mask, to stay 6 feet from others where you can, limit your social interactions with those outside your household. The way we're living is working. These techniques are working. We just need to keep it up as we get enough people vaccinated to end the pandemic. I want to give you an update on the vaccine distribution. As I mentioned, we're just under 500,000 Coloradans who've gotten their first dose. As of today, we 226,461 Coloradans over age 70 have received at least one dose. That brings us halfway towards our goal of vaccinating at least 70% of those 70 and up, protecting our most vulnerable. Last week, I provided an update on the projected number of vaccines we would receive between now and the end of February. Based on those numbers, I have more confidence than ever before that we will reach our goal for vaccinating at least 70% of the population 70 and up. And frankly, I hope it's even higher. I hope that, especially among those 65 and up, that we have better uptake on the vaccine than 70%. I really hope it's 80 or 90%. In our medical workers, it's 90%. These are folks who work in our hospitals and other. I would love to see that same rate of acceptance of the protection for people who have several hundred times chance greater of dying from COVID than people in their 20s and 30s. So certainly if you are 65 and up starting February 8th, if you're 70 and up now, I encourage you to get vaccinated. If you're signed up, your turn will come soon. It's randomized, and some people I hear from say I signed up and the next day I got it. Others say I had to wait a week or two. You will get it. You'll get it in February if you're 65 and up or 70 and up. And we are now at over 200,000 people aged 70 and up, and we look forward to expanding that to 65 and up shortly. Starting Monday, February 8th, people 65 to 69 across our state, as well as the people that are 70 up, can just sign up directly with a hospital, a pharmacy right near you, just like people 70 and up are doing now. Educators will be working with their districts, many of which have already partnered with providers to do that over a 3-week period to make sure that we can continue the safe return to school across our state. Earlier this morning, I had a call with the White House COVID task force, Jeff Zients and others from the White House. 2 main items to report out on that. One is that the federal government is adding additional vaccines. This is good news. They're going to increase next week our supply. We're trying to calculate the numbers, but probably somewhere in the 5,000 to 10,000 range that will be going directly to pharmacies in Colorado, 50 pharmacies. We also, as a state, have worked with pharmacies, CVS, Safeways, Walgreens. They're not as big as these big sites, or even in the aggregate, they're not as much as what our hospitals and community health clinics are doing, but they are important because not everybody lives near Coors Field or the Stock Show or a hospital or community health center. So especially in rural Colorado, but also for people who don't often have the transportation to get even 5 or 10 miles away. Being in local neighborhood pharmacies is important. And so we're glad that this is additional supply, that 50 additional pharmacies in Colorado will have likely between 5 and 10,000 doses next month. That's being done pro rata across the country, so it's direct shipment to pharmacies across the country fairly for all the states. We also had very good fiscal news from Jeff Zients today. A few weeks ago on a call with then President-elect Biden, I recommended that a good way to support the state's efforts was not only to do the 100% FEMA match, emergency funding match, on our coronavirus protection measures going forward, but to look into doing it retroactively from the start of the crisis. And they said they would look into it, and true to their word, today they announced on the call with governors that they would be doing 100% FEMA match retroactively, meaning the expenses that we incurred as a state around PPE that we purchased, around the convention center and those auxiliary sites will now be fully funded through FEMA because of the declared emergency. So 100% matching funds back to early last year in the initial declaration of emergency. We look forward to seeing the details and figuring out what that means for our state, but it certainly means that we will have additional resources to help fight the health risks that people have, support testing, support vaccinations, support PPE. And, you know, some of that, which I'll get into a little bit later, the state is buying testing for our teachers. We like to expand that for restaurant workers and others and supporting that. So this type of money that's now being reimbursed, we can help use to support testing to get Colorado more open safely sooner. Now, a lot of folks still want to know, how do I sign up to get a vaccine? It's very simple, and you can sign up on multiple sites. But you know, if you're 70 up and you sign up on one site, you'll get the vaccine soon. And if you really want to move it up a matter of days, yes, you know, you can sign up on 4 or 5 because one of them might come through tomorrow. But you know, as long as you're open to getting in the next week or two, one is enough. Sign up on one that's convenient to you, that's local to you. I mean, there are Coloradans that just to get it a week earlier want to drive 2 hours. That's fine. You can do that. But you will have the opportunity to place very convenient and close to you to get the vaccine in the next week or two. And here's some of those sites that you can sign up on. Denver Health, if you live in and around Denver, if it's easy for you to get down there, denverhealth.org/COVID vaccine, or call their number, English y Espanol, 303-436-7000. Very easy to sign up, Denver Health. Centura Health, vaccine hotline, 866-414-1562. Simply centura.org/vaccine. UC Health, which had the terrific, successful site that I visited at Coors Field, 10,000 people last weekend. And if we have more supply, we'd love to be able to do those large-scale sites even more. uchealth.org/COVID vaccine and 720-462-2255. Kaiser Permanente, kp.org/COVID vaccine/Colorado, number 303-338-4545. And by the way, if you can sign up online, if you know how to do that, if you're comfortable doing that, that's preferred. Keep those phone lines for people, especially among our 70 and up population, that aren't comfortable or having trouble signing up online. So if you can sign up online, go to that website first, kp.org/COVID vaccine/Colorado. Don't feel guilty if you're having any trouble. Just call the number, but try to sign up online first if you can. Boulder Community Health, bch.org, or you can call 303-415-7777. Vail Health, vailhealth.org/vaccines. Go online, you can make an appointment right there, or call 970-328-9750. SCL Health, and I'm going to talk about what they're doing this weekend, which is very exciting. www.sclhealth.org/vaccine form, or 1-833-762-0141. Health One is simply healthonecares.com/vaccine, or 303-453-2477. Banner Health has a number of different websites depending on where you live. Weld County, Larimer County, Morgan County, Logan County. If you have trouble, again, with any of those websites, don't feel guilty calling 844-549-1856. Salute Family Clinic at saluteclinic.org. And there's many more across Colorado. To find one near you, visit cocovidvaccine.org, or you can dial our state hotline number to help find a provider near you, 877-CO-VAX-CO. We're expanding the number of operators. At times, there's still been a 20 to 25-minute wait, but you can also schedule a call back when you call that number, and they'll call you back within a few hours, so you don't need to wait online. Last weekend, I visited 5 vaccination clinics here across the area. I even virtually joined a 6th clinic in Glenwood Springs for a virtual visit with folks that were administering the vaccine to people 70 and up in western Colorado. I stopped by Servicios de la Raza, Coors Field, which was in coordination with UC Health, great success, the Mental Health Center of Denver's Dahlia campus, the Seventh-day Adventist Church in Park Hill, and the Salute Clinic in Commerce City. We were so proud to see UC Health successfully vaccinate 10,000 Coloradans at Coors Field. If we have significantly increased vaccines, we like being able to have a few of those larger sites. As such, 10,000 is more than 10% of our vaccine for a week. So that's about the most that could go out through one site. But it was successful. It's scalable. If there's more vaccine, you'll be seeing more events like that. And the clinics hosted by community health providers have also been focused on helping to protect those who've been medically underserved, including Latino, African Americans, medically underserved. And these community health partners were able to vaccinate 1,000 Coloradans 70 and over. And we're so grateful for the organizers, state legislators, including Representative Celerina Gonzalez Gutierrez, Senator Julie Gonzalez, Representative Leslie Herod, and many others who helped to connect state resources to community resources to help drive equity in our vaccine plans. And it's so exciting for me personally to see the happiness and excitement on the face of so many of our older Coloradans, knowing that they're just weeks away from being able to see their grandkids and have poker nights with their friends and go to movies. And it's been very tough on people of all ages, those who've, of course, lost loved ones, incomparable, but also people who've lost work and jobs and income. And for many of our seniors, just that social piece that they've lost, not being able to be with and be around their friends, their family, their loved ones. And they are very excited that they will soon be able to safely be with their loved ones in their golden years. This coming weekend, SCL Health has worked with the state to have another large-scale clinic. 5,000 Coloradans will be vaccinated at the National Western Complex, people 70 and older. And they're working specifically to also help reach out to underserved Coloradans 70 and up. The event is already at capacity, and people need an appointment, so you've already been notified and hopefully confirmed if you're going to be one of those 5,000. And SCL is partnering with the City and County of Denver and more than 24 nonprofit community organizations to support outreach and registration of patients who are medically underserved. If you want to sign up for a future clinic with SCL Health, you can go to www.sclhealth.org/vaccine form. They might very well do another one at the Western Complex, just as at Coors Field. They'll look at doing another additional clinics through UC Health when there's enough vaccine to do so. So very exciting to see all this happening. More than halfway to our target of 70 and up. I hear from so many people 70 up who've gotten it, others who have their date, others who are still waiting to hear back, and you will. If you are 70 and up and you're signed up, you will get that opportunity to get that vaccine in the next week or two. And we encourage you to tell your friends as well, because we'd love to be over that 70% number, especially when we see the impact on saving lives of those who have the highest risk from this virus. While it's exciting that more Coloradans are being vaccinated every day, it's still, in the scheme of things, a very low number that are protected. The pandemic is still here. Over 8% of Coloradans have received at least the first vaccine. Just under 2% have received both vaccines. So that is, from a epidemiological standpoint, it is not yet significant in ending the pandemic. That means we have the same tools we always have. While some people have personal protection through a vaccine, we all have to undertake the directions to wear a mask when we're around others, keep a distance, limit socializations, and we're moving in the right direction. And we're working on additional outreach to make sure that we continue moving that right way. And as we get close to different events that sometimes involve socialization, like President's Day and spring break, our Colorado Tourism Office is launching the Do Colorado Right campaign, which is aimed at educating winter travelers, both in-state winter travelers from the Front Range going to western Colorado, as well as out-of-state travelers, to avoid risky behaviors in Colorado. Enjoy our great state. For the out-of-staters, please spend money here, but be safe and honor the way that we do things to prevent additional outbreaks in our state and unnecessary loss of life. And we know that many Coloradans are getting back on the slopes, as are people from across the country. And we want to make sure that here in Colorado, they know that they can have the confidence to enjoy their time here, and that we're doing everything we can to slow the spread of the virus. That includes wearing a mask, staying at least 6 feet from others, and enjoying winter activities with people in your household. And of course, staying home and getting tested if you're having any symptoms at all. I'm proud to say that the Do Colorado Right campaign will feature high-profile Coloradans, including Olympic gold medalist snowboarder Red Gerard, two-time Top Chef competitor Brother Luck, Bachelor contestant Ben Higgins, TV medical advisor Dr. Payal Kohli, and fashion blogger Esther Leach. So we got a great crew of talented Coloradans, famous in their own realms, with the Do Colorado Right message. And I'm going to share some of the clips of what we're going to be showing to folks across the country.
When I go out, I do this, or even this. Okay, maybe not that.
After I ride, I don't do this. I do this, and just to be safe, I do this. That's how you do Colorado right.
I like that. Just to be safe, I do this, and you keep 6 feet vertically from somebody. We think in 3 dimensions. Vertically counts for social distancing if you're able to. A couple of weeks ago, we announced our exciting partnership with Binax to provide at-home testing for educators and also for students, students who exhibit symptoms, students who can't wear a mask because of special needs. I was thrilled to personally deliver tests to 12 teachers across our state: Colorado Springs, Pueblo, Arvada, Parker. This at-home testing regime further increases the safety of in-person learning for both students and for educators and the whole school community. And through this program, 1 million tests are being sent. Many teachers that I wasn't able to reach, they're going to be getting them tomorrow. I'm glad I have some help because it took me half a day to deliver 12. So you can imagine how long it would have taken me personally to deliver 1 million. But thankfully, Amazon and other partners are helping to get those out. So teachers will get them this week for participating districts. All the tests come with telehealth support. In a box, there's 6 tests. 6 tests is 4 weeks worth, once every 5 days. It's very simple, takes 15 minutes. The teachers do it at home. It is very exciting to really be able to help inspire confidence in our schools, private schools, charter schools, public schools, to help make sure that kids can have uninterrupted, safe education, especially as we move forward with the layered protections around classrooms to make schools one of the safest places during a pandemic. It's not just good for health and safety, it's good for all of us, for our kids' future, for our economy, for our workforce. So I know that we can do this, Colorado. We're not crossing the finish line yet. We can see the end. We're excited that starting February 8th, every Coloradan 65 and up will be able to be vaccinated. And we're looking forward to working with the federal government to continue to increase the supply of vaccine in our state. I'm happy to take some questions.
Governor, can you talk about the expansion of the Binax program to restaurant workers?
Yeah.
What is the timing going to look like on that?
Yeah, so we have secured about 2 million Binax tests a month. The first priority for the utilization of those tests is safe return to school. So once we get the final numbers back on what we have left after the participating districts and educators use them, we will be able to design the exact parameters around the other programs to support restaurants and other essential businesses with additional testing. So we don't yet have the number or the program parameters, but we'll be announcing that in the coming days. But we know that there'll be a significant number of tests that we have available for other uses after we meet the needs in education.
Hi, Governor. This is Joe Vaccarelli at Denver 7. I have a question and a follow-up, if that's okay. First off, we've been getting some comments from people who have lung conditions but are in that 18 to 64 age group. Is there any clarification for them as to when they might get the vaccine? I'm talking about people outside of PD.
Yeah, and I'll let you have some follow-up question later. But in our current planning, we show a March 5th date for when people with two pre-existing conditions that put them at greater threat to the virus, who are 16 to 64, would be eligible for the vaccine. But I wouldn't put a lot of stock in that date. We certainly hope it's sooner, and the exact parameters will depend on the supply that we get. We're very confident with what we have now through February, 65 and up, teachers, February 8th, reaching the goals through the end of February. We just don't know the quantities in March. So I hope that the March 5th date can be moved up a week. I hope that the categories can be expanded. But in our current planning, people with two existing conditions that put them at greater risk are eligible March 5th. Follow up?
Yeah, and as for places that are giving out the vaccine, is there any guidance for how they can disperse leftover vaccine at the end of the day? We understand that some are calling 15 minutes ahead of time to give out the reserve of their vaccine if they're not able to give out all the shots in one day. Is there any guidance on who can be on this or how that can be dispersed?
The guidance is to waste no doses, and you are to use any available vaccine on anybody that's there. Now, that doesn't mean that people should be loitering and hanging out at vaccination sites. Usually they have this down to an art form where they have an exact number of doses for the people scheduled. But occasionally there's one or two extra doses, and they will administer them to people who are available at the site. Usually in most sites it's additional medical workers that haven't had the chance the first time through to get it. Sometimes it's people over 70 who brought their spouses. But generally speaking, you have an appointment, you show up, you get it. There are very few extra doses, but when there are, we absolutely want them used immediately.
Governor, Charles Ashby from the Grand Junction Daily Sentinel. I hope you're doing okay, sir. So our health expert out here is putting together his draft under the new or soon to be revised COVID dial. And he's thinking that businesses here, because of that and our 5-star program, will be able to get to about 70% capacity. But he's bemoaning that he doesn't think that the new dial is going to take into account the number of vaccines that are given out. Can you give us an update on where that process is? Do you think those things are realistic, and are vaccines going to be built into the new dial setup?
Yeah, so we plan one additional dial update before we are able to abolish the dial system and the pandemic ends, that will likely build in a vaccine ratio into movement towards complete normalization. So that'll likely be an update in March. There's a thoughtful discussion that we want to have with local public health and business community and the local electeds around that. These are changes that we feel comfortable with moving forward with immediately based on learning and data from the last several weeks and months, the state of where the pandemic is in Colorado today, as well as accounting, not in a specific sense, but in a larger sense, for the existing levels of immunity from prior infection and small but growing from vaccinations. So while vaccinations are not explicitly built into this update because they're not yet significant enough to have an impact on the pandemic, they will be explicitly built into the final update before the end of the pandemic.
Hi, Governor. It's Jessica Seaman with the Denver Post. I want to ask you about expanding vaccinations to those 65 to 69. One of your top officials running the vaccination effort has said that that age group probably won't get their shots until next month. Why go ahead and expand eligibility to this group especially when we've seen for those 70 and older that, it's been an issue with the expectation being given that they are, as soon as they're available for the shot, that they're going to get it, and they're struggling with these long waits.
Yeah, so I don't think, I'd have to look at exactly what he said. I mean, certainly some who are 65 and up might take a few weeks, but many who are 65 and up will be getting it beginning next week and the week after. So it will be randomized, and certainly we need a larger pool soon. We're about halfway towards our goal of 70 up. By the time we reach February 8th, we will be in excess of 60, if not 70% of the goal of 70 up, meaning that if we don't expand the pool around that date, people could argue it should be February 10th or February 7th, but around that date, if we don't expand the pool, there will be a slowdown in administering the vaccine because there simply won't be enough people age 70 and up to use every vaccine in real time. So that's why around that date we need to expand it, because that final, let's say we're 65% of the way, 70% of the way towards our goal, that final 30% of 70 and up will take a few weeks. Not everybody will be able to get it right at once. Some are delaying, but we want to get it out. But the top priority is to use every vaccine every day quickly. And so we need a sufficient pool of people to do that. And that's why we're expanding to 65 and up. Absolutely, some people age 65 and up will be able to get it February 9th, February 10th. Some will get it the following week. Some will get it the week after that. And yes, there might be some who are 65 and up, about 288,000 in total. Some might not get it until that first week in March.
How are you going, when this new group comes in, because it is so many people, how are you going to specifically make sure that those 70 and older who are at such a high risk of severe COVID are not pushed out of these waiting lists and they're having to wait even longer for these shots?
Yeah, most of the providers will be through much of their waiting lists. I talked to one major provider that said they're 70% through everybody who signed up, 70 and up. Different than our 70% goal, because these are people that want it already. They signed up, but they're 70% through of the subgroup of 70 and up who want it, and that was as of a couple days ago. And there'll be a few more that sign up, of course, that are 70 and up in the coming days. But yeah, we'll be through, as I said, we're through more than half of the goal already for 70 and up. I expect that by February 8th, February 9th, we'll be through even more. And there will continue to be people 70 and up in that following week and the week after. But we'll be going as fast as we can. We have to expend, there simply won't be enough people 70 and up for us to fully deploy all the vaccine February 9th and beyond. We have to expand that criteria, even though there are some that are 70 up that haven't received it yet. Because in some areas of our state, they've made greater progress than others in 70 and up. They've largely completed that, for instance, in Eagle and Summit County. San Luis Valley leads the state in high numbers for 70 and up. There's still many to do, but they'll generally be finishing them up. And then the demand will, it's sort of a curve, and it feels like it's peak demand right now for 70 and up, and some folks might have been waiting 2 or 3 weeks, and they might have to wait 1 week more. But we'll rapidly be bursting through that just based on the numbers. We know exactly, there's 588,000 people age 70 and up, and we have already vaccinated 226,641. So we just know based on the numbers that where we will be, we will need to expand that criteria around February 8th, which is why it's going to 65 and up. If there are communities that haven't made enough progress on 70 and up, they absolutely can stick with that as a priority for another few days until they open it up to a broader group.
Hello, Governor. Jesús Carrasquel from Noticias Univisión Colorado. Gobernador, usted entregó pruebas caseras de coronavirus a maestros, pero ¿dará ayuda adicional a los educadores que enseñan a niños con capacidad? Y otra pregunta sería, ¿cómo podrán los maestros tener acceso a la vacuna del COVID-19?
Estas pruebas están siendo distribuidas a educadores y a niños que tienen cosas que les prohíbe usar máscara. Lo único que tienen que hacer es que su distrito se inscriba para recibirles, y la mayoría ya son, En cuanto a la vacuna para maestros, ellos la recibirán por medio de su escuela o institución que están trabajando con proveedores para vacunar a sus trabajadores. Escuelas deben ser un lugar seguro para los maestros y también para los estudiantes. Y con nuestro plan, escuelas son uno de los lugares más seguros durante la pandemia.
Hi, Governor Polis, Claire Cleveland, CPR News. Equity continues to be a concern with distribution in different neighborhoods in the hundreds and mass drives for largely white folks in the thousands. Has the state considered setting aside some doses of vaccine to be used only for Black and Latino residents who've fallen behind most dramatically? And if not, what other options does the state have for improving these numbers other than time and supply?
Yeah, we are setting aside doses for equity, and equity means more than it means a lot. It means for any regional disparities. It means for racial disparities. It means for the medically underserved, and that's why we are very aggressively partnering with community organizations to be able to meet people where they are to help improve the equity of the vaccine distribution. It's clear that it's unacceptable where it is on its own, and that it takes a specific effort of the state to partner with trusted authorities in communities of color, in low-income communities, to help make sure that we can protect more Coloradans to end the pandemic. Did you have a follow-up?
Thank you. Yes, I do. To shift gears a little bit, why were higher education employees who work and teach on campus, often with students in congregate settings, excluded from Phase 1B and not mentioned in 1B3?
So we are, as you know, we've been focused on returning to schools for our families for many months. There are many school districts in Colorado that have been in session all year long successfully, and we applaud them. In fact, the majority of districts have been back the whole year, but not the majority of students, because some of our larger districts have only had limited in-person education. And in-person learning for preschool through 12th grade is so important for a number of reasons. One, many of the smaller kids in particular, but to a lesser extent high schoolers, but certainly in grade school, have difficulty getting the academic mastery they need through online education. Two, especially those who come from households where two parents work or a single parent household, it makes supporting their online education needs very, very challenging, and has led to many parents having to drop out of the workforce, cut back their hours, and put their economic security at risk. We already have seen that remote learning in pre-K-12 has already hurt participation of women in the workplace as well. It has negative effects on mental and physical health of children. And of course, to some extent, all of these same issues affect higher education. But we do know that, you know, a 20-year-old is able to safely learn from home by themselves in a way that a 7-year-old simply can't, requiring the presence of a parent to do that. We want everybody to be able to go back safely, and we're happy to support our institutions of higher education in a safe return. But I think it's important that we walk before we run. I know parents across our state are really counting on our schools coming back to in-person education, and many are, and I want to thank them for doing so.
Hello, Governor. This is Ed Seelover with the Denver Business Journal. I want to follow up on the Do Colorado Right campaign, which was a marketing campaign of sorts, but certainly not the typical one the Colorado Tourism Office does. I know you've been reluctant to kind of push the full-out marketing to out-of-staters at a time of pandemic, but I see that some other states in the mountain region are starting to do that. What are your thoughts on when you'll feel comfortable giving the tourism office the go-ahead to really try to attract people from outside the state again to Colorado for such an important sector of the economy?
Well, we are thrilled to have visitors from across the country and across the world as permitted, and we do have some international visitors from countries that allow their residents to come to the United States, especially in the high country. And this campaign is very consistent with that. By showing that Colorado values safety, we also inspire consumer confidence in tourists in California, New York, and Texas who are looking where to spend their tourism dollars and when to spend the time. We want to make sure that they have the confidence to know that Colorado is a reasonably safe destination during the pandemic, and we encourage them to spend their time in our great outdoors enjoying our winter activities.
This is Erica Meltzer from Chalkbeat. I was wondering if you could address specifically the early childhood sector, are you going to be setting aside a portion of doses for childcare providers so that they can compete with school districts that might have a lot more organizational capacity? And what sort of outreach are you doing? So for example, the woman who runs a small in-home daycare knows what she needs to do to get the vaccine, and she doesn't have a whole school district helping her figure that out.
I would say, so in expectation setting, we have what's called the census count. We know the number of people that work in early childhood, in education around kids. It's about 120,000. That's a lot more than just teachers. It's early childhood instructors. One of the tests I delivered was to a school secretary. It's librarians, all of the above. So we know that number, and we have effectively budgeted for that number in that we will have the vaccines to meet the full need of those who work in early childhood, daycare, education over a 3-week period, as we discussed. Your point is correct that it is very likely that the larger and more organized school districts will likely be setting this up in week 1 and 2. And that might mean that your small provider who has to set it up themselves might be in that 3rd week. But the way we view it, we have enough for everybody in that sector over 3 weeks. And so there's not that much of a delay and that the school districts can cause by going a little bit earlier. And even the school districts can't do it all in 1 week. There's not enough vaccine for the large school districts to have every teacher vaccinated that first week. That's why we've tried very hard to set that expectation 2 to 3 weeks, because that is simply the amount of time it takes for us to have the vaccine that is needed without slowing down protecting our 65 and up and 70 and up, which is our health priority as well.
And just a follow-up question, are you doing anything in particular to help reach this sector, make sure that these folks know?
Yeah. So I would encourage,
because that's been
So I would put private schools in that. With private schools, childcare, I would encourage them to contact their insurer and their provider that's in their network to set up a time where they can do a clinic for their employees. And private schools will be doing this. Charter schools are generally going through their district, but they can go on their own. But and the diocese, which runs a whole bunch of private schools, they're going to figure that out for all their schools. But an independent school or a daycare center should have that conversation with the provider that is part of their network to figure out the best way to schedule their folks to come in expeditiously. But we have budgeted the full amount of vaccine that is needed for that population over a 3-week period. And does that mean that somebody somewhere won't be able to set it up till the 4th week? I'm sure that's probably the case, but we have enough vaccine at least for that to occur over a 3-week period. We will have enough vaccine. We don't have it now, but we have the confidence in the future supply.
Hey, Governor, this is Gabrielle from Fox 31. 2 quick questions for you. The first being that many people who are 70 and up who seem to be having issues getting signed up last week are seemingly having better luck this week getting a call back. So what has the state been doing sort of behind the scenes to move things along for this age group when it comes to vaccines?
Yeah, first of all, we know that a lot of people of all ages, even me sometimes, have trouble signing up online forms, but especially folks over 70. So that's why we've made these phone numbers available. And then the wait times were too long, so we expanded capacity at the numbers. So 1-877-CO-VAX-CO is kind of the central one you can go through. Each of the providers have their own toll-free or local number that people can call if they're having trouble with the web form. And yes, we're also hearing so many people that had signed up a week or 2 ago, hadn't heard back. Now, finally, they're getting their chance to set up their appointment, and they've set it up in the next few days. We are moving through that 70 and up group rapidly. And yes, some will be next week, and some will be the week after, but it's getting a lot quicker. The waits are shorter, and we will continue to move rapidly to complete the vaccination of everybody 70 and up who wants it. And I really hope it's greater than that 70% that we targeted. I really hope, especially for our older Coloradans, that 80 or 90% or more want this vaccine, because they are at a much higher risk of having fatal outcomes if they contract this deadly virus.
Got it. And my second question involves communities of color when it comes to getting the vaccine. You referenced earlier about how low those numbers are when it comes to people within the Black and Latinx community. I know the state has some events coming up to address that, but my question for you is, how do you boost interest in communities of color, just seeing that there is so much skepticism out there within the community?
Yeah, so that's part of the issue, right? We're reaching out. We did the just clinics last weekend at Servicios de la Raza, Dahlia campus, a Seventh-day Adventist church, the majority minority Salud clinic, reaching people where they are, because part of the issue is lack of transportation, lack of access, lack of knowing where to sign up. But the other part of it is the confidence and the willingness to accept the vaccine. And so word of mouth, working with faith leaders, community leaders, including elected officials, to make sure that people know that they have the confidence in the science that this will protect them. So both of those in tandem will help address some of these alarming equity gaps that exist in vaccine distribution.
Hi, Governor Seth from the Gazette. Two questions for you. One, can you provide an update on when the proposed dial framework will be implemented and when counties will be readjusted under that dial framework? And two, there's been reporting elsewhere in the country that people have been going into underserved communities where there's these sort of specific vaccine events, communities that aren't their own, to sort of jump the line. Since Colorado isn't requiring ID, can you kind of talk about what the state will do to ensure that doesn't happen, if there's equity?
Yes. So the deadline for comments on the dial update is tonight, I believe, 5 p.m., 7 p.m. Anyway, we'll get you that. It's tonight. The CDPHE and our health team will spend a couple days going through those suggestions and recommendations. I understand there's over 1,000 comments already. And I hope that they will finalize the updates by Thursday or Friday in time for the weekend. That would be the goal. But we want to do a thorough job of making sure that they look at all of the input that has come in, and that takes a few days. Yes, so these community clinics are generally not advertised and promoted ahead of time because the goal is to serve people in the community, and nobody's ever turned away. I mean, they're all diverse. They're not exclusively Black or Latino or anything like that, but the goal is to go into areas where we can serve those who are medically underserved and need it. And so that is at odds with promoting it ahead of time and having people come in from other areas who otherwise could be served at Coors Field or the Western Complex in a drive-through because they have a car and that's very convenient for them. We'd rather that they do that. So that was successful. I don't have the readouts on the statistics from this weekend, but being at many of these, 5 of these clinics, while, I saw people of all races, very diverse. It was people were well represented. They absolutely will help bridge the equity gap. And there are people who have barriers to medical access of all races, right? It's about Black and brown, but it's also about underserved immigrant communities of Eastern Europeans. It's about low-income Coloradans of all races who don't have a medical home. And so it's really important that we take the steps to end the pandemic to successfully reach out to everyone to make that vaccine available in an easy way. Folks over 70 who don't have cars or vehicles or ability to get to an appointment that's only 4 or 5 miles away. It's important that we're, again, in those communities offering that vaccine to end the pandemic.
Hi, Governor. Jason Grenauer with Denver 7. Once the next group opens up, the 65 and up, the teacher group, will those 70 plus who haven't gotten the shot yet be given preference over those in the next group in getting theirs?
Yeah, there will be enough vaccine over those weeks to hopefully complete everybody who's 70 and up who wants it over the next few weeks. It's a matter of scheduling. We're already, as I said, halfway to our goal, more than halfway to the goal. By February 8th, we'll probably be between 60 and 70% of the way to the goal. And then it'll simply be a matter of scheduling those remaining people age 70 and up. But I'm confident now in saying, as I was before, that everybody age 70 and up who wants the vaccine will be able to have it by the end of February, and if not sooner. Now, there are some people 70 and up that are still going to get it in March and April because they're just not signed up and not ready to get it yet. That's why I really hope that 70% number goes to 80 or 90%, right? It doesn't mean it's 100% ever. We want to keep focusing on convincing people 70 and up to get it. But right now, plenty of people 70 and up want it. Many have gotten it. Many know when they're going to get it. There's still some that don't know when they're going to get it, are signed up, want it. They'll find out in the next week or two. They'll be able to get it in the next few weeks. Thank you all so much for joining us. Stay safe, Colorado.